Bernie Sanders likes to imagine this alternate reality where you're born and you get a Social Security card and a choice for a government-run health insurance plan. That's the concept. You don't have to pay for one. You don't have to purchase health insurance.
Yeah, when as crazy as Medicare for All is anyway, when you put into the context of what we just found out, once again, from the trustee, the Medicare trustee, we see that we're 7 years away from the Medicare for already on it collapsing. So we're facing insolvency as it is. So it would take someone like Bernie Sanders to go, hey, you know what? When you've got a massive train wreck in front of you with enormous implications to seniors in this country, you know what you do? You get everybody else on that train. That'll be great. Now, really, come on. Now, that's just one of the issues with healthcare. We've had a series of stories recently, including Q&A, that dealt with medical care that actually was becoming more expensive with health insurance than without. And joining us now, healthcare expert Seth Denson, GDP Advisors. And Seth, we talked about the failures of the insurance first marketplace, but some of the stories that continue to roll in are remarkable. I want to give you this example. It was a Q&A a couple days ago. Listener said that they ended up having an ER visit for their son. Ended up costing $1,950 because the ER couldn't locate their insurance. So once she ended up getting the bill, she called back with the insurance information. They resubmitted, and by the time they got the adjusted bill, it was over $30,000, and their piece of it was $8,000. And there was nothing that the hospital said they could do because that was the insurance adjusted rate. And when I shared that story, I heard from other listeners who had similar experiences. How common is it, Seth, that insurance doesn't just mask the cost problems, but actually creates much higher costs in healthcare?
Brian, good to be back with you. Well, listen, I mean, we've talked about it on your show a number of times because insurance is just the credit card. And so what happens is the way that the insurance markets work in collusion, if we want to use that word, it's a fun word of the day, with the healthcare delivery system, they're in contract with one another. And by signing the terms and conditions, when you buy an insurance policy, you in turn are now under contract based on how the Amex card, that is insurance, has agreed to compensate said hospital system for the services that they render, which oftentimes are much more expensive on the back end than they would be if we just paid cash up front.
And I think this would be a bigger outrage, except that it's rare that many people are ever see the real cash price of healthcare. They are just used to seeing their insurance piece. But do you think that this is common, or the story I shared with you, is that an outlier?
No, it's not. It's definitely not an outlier. This is very common. As a matter of fact, I think that if most of your listeners would next time go ask for a detailed bill from the hospital system that they visit, they would be shocked to see what the bill charges are and how it's negotiated. We focus on what the insurance companies want us to focus on, which are the co-pays, the co-insurances, the deductibles, those types of things that really impact our bottom dollar on the front end. But what we don't realize is those are just minimum payments on the credit card that's coming due, and that our insurance premiums are getting increased every year as a result of how much is getting billed back. And it's all in operation with one another to keep us in the dark as to what the real cost drivers in the healthcare system are.
And Seth, when we talk about the Medicare situation, first, I want to get your thoughts on the trustee report, Al, showing that, hey, now we're down to 7 years before we have insolvency.
Yeah. Well, listen, I think when it comes to Medicare, it's funny, the Democrats and the progressives are keep coming out and talking about Medicare for all. If you actually look at the policy specific that Senator Sanders has proposed, it's not Medicare at all. Medicare actually still uses part of the private pay system. What they are talking about is a single-payer government-run healthcare system in and of itself. And even the current Medicare system, which relies on the private health insurance marketplace, is insolvent to the point that you just made. And so what we're trying to do, or what Bernie Sanders is trying to do, is now say, hey, we're going to give you a system that's already insolvent, but we're going to double down on it and take the private insurance market out of it completely and just say, we, the government, are going to control this.
Well, and I don't mean to impugn Medicare because we've got ourselves in a boxed situation. It works well generally for the people who are on it because they have been made those promises and they should be kept. That being said, ultimately, isn't Medicare, just like other insurance, masking a lot of the underlying cost problems that if we had transparency and if we knew what stuff really cost, that we would be able to be better consumers and drive it down?
That's exactly right. Listen, our healthcare system works like every other consumer-driven system in the marketplace, except for one key thing. We, the consumers, don't have the information. And so in a free market system, the consumer can control the mechanisms of how the system works. But healthcare has become so inclusive and so non-transparent that we, the consumers, are focusing on the wrong things because that's the bill of goods that we've been sold. Hey, focus on your copays, focus on your deductibles. Don't focus over here that we're billing back to your plan $16,000 for an IV bag that cost $1 to produce, because that shouldn't impact you today. Well, it doesn't impact you today. It impacts you tomorrow and the year after and the year after. And so as we start to unbundle what Medicare for All would look like and how it combines with the current system or single payer and all of this, it all comes down to the fact we've got to drive down the cost of delivering health care. It's way too inflated. And giving away something very expensive for free to everybody doesn't solve that problem.
Such a good point. Seth Denson, GDP Advisors. May follow him on Twitter at Seth Denson. Be well. And what he was just talking about there, you might remember if you listened a couple days ago, shared with you the information that every single year, since we had a majority of Americans on health insurance, we've seen the cost of healthcare rise above the level of inflation. It goes all the way back to the 1960s. You had health insurance prior to Medicare, which came about in the mid-60s. But the average American wasn't on health insurance. And prices were stable up to that point. But as soon as we introduced this system to where you never see the cost of something, and a medical service provider doesn't directly have to be accountable to you for the cost, simply send you a bill after the fact with whatever the result of the monkey feces fight was with the insurance company. Here's your piece. They can just get away with charging as much as they can possibly charge. And I don't necessarily blame the medical service providers because it's what the insurance companies will go along with. But we're the ones left holding the bag for the ever-rising cost of health insurance and for the ever-rising cost of health care that goes along with it. And so whether it was the example from the Q&A a couple of days ago, an example that I gave you, some others that have rolled in, I think we'd be horrified if you have never asked what the cost is of your health care. You've always just signed a piece of paper that says, yeah, you know what? I don't know what's going to happen in here. I don't know what it's going to cost. I don't know what my insurance is going to pay for and what I'm going to have to deal with, but I'll pay it, whatever that number is. Before you sign that, if instead you ask them what it would cost, once you get past the fact that you'll probably get some surprise looks back, although I am hearing from more people that are doing this and it's making a difference, you might end up getting shocked at what the cost difference is over what it would be with the insurance company. Because as Seth was pointing out, the only thing that's an outlier about some of these stories we're sharing where healthcare gets a lot more expensive once you introduce insurance into the mix, the only thing that's an outlier, people having the information about what the real cash cost is before the insurance company gets involved. And just think about it realistically for a moment. What is the insurance company? It's a middleman, right? So if you're introducing a middleman every time you do something for healthcare, are you not necessarily by definition going to be introducing more cost? Well, of course you are. Which again is why we need to get to a system of health insurance that works like every other form of insurance in our lives, where we pay for all the regular stuff out of pocket. And we have consumer price transparency. And then if we have an emergency, like we have a car accident, then you hit your insurance. But if your car just needs maintenance, go to the mechanic, right? That's where we need to get to with healthcare and health insurance. Got to break the back of this insurance first model.